Joanna Fawzy Doran, Esquire, is a cancer rights attorney and CEO of Triage Cancer, a national nonprofit organization providing free education on cancer-related legal and practical issues through events, materials, and resources. Mrs. Doran has spent nearly 30 years working on behalf of the cancer community and is a trusted resource when faced with the myriad of questions related to insurance coverage and navigating appeals. I turn this over to you, Joanna. Thank you so much.
Welcome, everyone, to the session on navigating insurance and appeals. My name is Joanna Doran, and I am a cancer rights attorney and the CEO of Triage Cancer. And today, I want to give you a little bit of information around some key tips for navigating insurance and the appeals process when an insurance company denies coverage for your care. So I want to start by telling you a little bit about Triage Cancer, so you know that if you have additional questions or want more information after this session, you know where to go for that information. Triage Cancer is a national nonprofit organization that provides free education on all of the legal and practical issues that might come up after a cancer diagnosis. And we do that by providing free educational materials and resources, as well as hosting free events. And I'll tell you a little bit more about some of the other programs we have towards the end of the presentation. But we do have information in lots of different formats. So everything from a quick guide to a 5-minute animated video to a 15-minute podcast to a more in-depth practical guide to cancer rights. So you can find information on all the topics I'm going to talk about today, as well as many others on our website at triagecancer.org. So when we hear in the cancer community that cancer is expensive, or that it causes a financial burden after a diagnosis for patients and their families, or you hear the term financial toxicity, which is where that financial burden is having a significant impact. The problem is that it's not a simple solution because there's not one answer to that financial burden. There are lots of contributors to financial toxicity. And at Triage Cancer, we actually think that the number one contributor to financial burden is actually having inadequate health insurance coverage. So you might have health insurance, but it might not be the best health insurance plan for you based on your needs. You also have to know how to use your insurance effectively. And we're going to talk today about that specifically. But it may also be the situation where you have a change in your employment, where you might have to reduce your hours or take time off, or maybe even apply for disability insurance because you have to be out of work for an extended period of time. Those things are going to have an impact on your income, both for you and for potentially caregivers as well. And then certainly your existing financial situation is going to contribute to how a cancer diagnosis will impact your finances. And then all the regular life changes that continue to happen that can have an impact on your finances will. So things like moving or graduating from school or getting married or divorced may also have an impact on your finances. So all of these things together contribute to someone's financial situation after a cancer diagnosis. And at Triage Cancer, we have a lot of information to help you navigate all of these potential contributors. But for today, I really want to focus on health insurance. And unfortunately, I have said for a long time that no one in the United States really understands health insurance or how to use it. And that just used to be my anecdotal opinion based on the work that I've done over decades. But now I have some data to back it up. Only 4% of Americans can actually define the 4 key terms used in health insurance coverage. That means that 96% of us can't. So it's not surprising that only 40% of Americans said that they were confident that they could choose the right health insurance plan for them. And I actually even think maybe they are overconfident. So if you feel like you don't understand your health insurance coverage, you are absolutely not alone. The majority of people do not understand health insurance or how it works in the US healthcare system. So unfortunately, in the United States, we spend a lot of time as consumers buying things. So we research, buying a new car or a new computer. We spend 5 hours planning vacations, but we only spend 15 minutes or less choosing our health insurance plan. And part of that is because we don't really have the education about how to choose a health insurance plan. We always say at Triage Cancer that it's the type of thing that we should be taught in high school because everybody has to figure this out when they become an adult, but not everybody gets the education on how to actually do that. So those 4 key terms are what I want to start with today. But first, there are costs that we have to pay just to have health insurance coverage. And that's typically referred to as our premium. It's what we pay each month just to have health insurance. Even if we got no medical care during the year, we'd still have to pay our monthly premiums to have health insurance, similar to car insurance, for example. But then there are costs that we pay when we actually get medical care and use our health insurance coverage. And the first is our annual deductible. It's what we have to pay out of pocket first before our health insurance coverage even kicks in. And it is a fixed dollar amount, and the amount depends on your plan. So you might have a $250 deductible, or you could have a $5,000 deductible, or maybe even a $0 deductible, depending on the plan that you have. But then there's something called a copayment. And this is also a fixed dollar amount that you pay when you get certain types of care. You might have a $20 copayment to see your primary care physician. Or you might have a $50 copayment if you're going to see a specialist. Or if you have to go into the emergency room, maybe you have a $500 copayment. Again, the amounts are going to depend on the plan that you have. And copayments are different from coinsurance or cost share. Those are 2 terms that are used the same way. They mean the same thing, and it's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 plan, the plan is going to pay 80% of your medical expenses, and you're responsible for 20% of your medical expenses. And then probably the most important thing for anyone to know about their health insurance coverage is their out-of-pocket maximum. That's a fixed dollar amount that when you reach that fixed dollar amount in spending for your out-of-pocket expenses, your insurance will kick in at 100% for the rest of the year. You might have a $1,000 out-of-pocket maximum, or you could have a $10,000 out-of-pocket maximum, depending on the plan that you have. And the way that you get there is actually a math problem. So you get to add up what you pay for your deductibles, plus any co-payments that you make during the year, plus any co-insurance amounts that you pay during the year, and it helps you reach that out-of-pocket maximum. And again, when you do, then your insurance will kick in at the 100% for the rest of the year and pick up all of the rest of your out-of-pocket expenses. So to give you an example of how this actually works, Dan has a plan that has a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. He spends the week in the hospital, and he walks out with a $102,000 hospital bill. What does he actually have to pay of that bill, assuming he's had no other medical expenses during the year? Well, he has to pay $8,000 because that's his out-of-pocket maximum. That's the most that he has to pay of the bill. But this is how you get to that number. So first he pays his $2,000 deductible, which leaves $100,000 left of that bill. But he has an 80-20 plan, so the insurance will pay 80% and he's responsible for 20%, which is $20,000. But how much does he actually have to pay of that $20,000 bill? Because he has the $8,000 out-of-pocket maximum, and he's already spent $2,000 towards his deductible, he only has to pay another $6,000 before he reaches his out-of-pocket maximum. And then his insurance is going to kick in and pick up the rest of that $20,000 bill. So that was a lot of math. And if you want to hear it again, it's actually in one of our animated videos on health insurance basics. So the terms and this example. So if you would like to see it again or to share with somebody else, you can watch that animated video. But when we talk about legal issues, the devil is always in the details. And so you really need to understand how your out-of-pocket maximum works for your plan specifically. For example, you might have an individual out-of-pocket maximum and a family out-of-pocket maximum if you have more family members on your insurance plan. If you have a marketplace plan, then your out-of-pocket maximum is required to include the deductible, the co-payments, and the co-insurance amounts, both for any medical care that you receive and your prescription drug coverage. So that's the most protective for healthcare consumers. But some employer plans can actually carve things out of the out-of-pocket maximum. So some employer plans don't include deductibles. They have the deductible and then the out-of-pocket maximum. Some don't include deductibles or co-payments, and they only include co-insurance amounts that help you reach your out-of-pocket maximum. And some plans only, or some plans actually have out-of-pocket maximums for medical care and then also out-of-pocket maximums for prescription drugs. So you actually have to add those two things together. So really the moral of the story is you have to make sure that you understand how the out-of-pocket maximum works for your plan specifically, but it's very important because in a worst case scenario, that's the most that you're paying out of pocket for your medical care during the year. Now, the other terms that I want to mention today are about how insurance companies contract with healthcare providers. If a healthcare provider and an insurance company have a contract together, and that provider is part of the insurance company's network, that means that the insurance company is going to treat that provider as in-network and that they have agreed on a specific amount called an allowed amount or a contracted amount that the insurance company will pay the provider for certain types of care. If a provider doesn't contract with an insurance company, then that provider is considered out of network of the insurance company, and they don't have an allowed or contracted amount, which means that that out of network provider is not limited in any way in what they can charge. And so it's important to understand that if you are looking for a health insurance plan, that you make sure that your providers are in that plan's network, so that you're not paying more than you need to for that care. There are also some key terms related to prescription drugs that are helpful to understand. And the first is called the formulary. That's the list of drugs covered by a particular plan. And a formulary is broken down into different payment tiers, meaning that where a drug falls on the tiers will change what you pay out of pocket for that drug. So this is just an example of what a tier could look like, where tier 1 drugs include the cheapest generic drugs, like an antibiotic. And when you go to pick up that prescription at the pharmacy, you're only paying a $5 copayment per prescription. And then the tier 2 drugs include more expensive generic drugs and some preferred brand name drugs. And there you'd pay $25 as a copayment for each prescription. And then at tier 3, it includes more expensive and non-preferred brand name drugs, where there you're paying $100 per prescription when you go to pick it up at the pharmacy. And then tier 4 is where we include specialty drugs or drugs that are newly approved by the Food and Drug Administration. And there, you're not paying a co-payment, you're paying a co-insurance amount. So a percentage of the cost of the prescription. So it's important to realize that most cancer-related drugs actually are specialty drugs and do usually have a co-insurance amount that you have to pay, rather than a flat fee copayment. And unfortunately, if you have an expensive drug, 20% of an expensive drug could be a lot more than $5 copayment or $100 copayment. And so understanding how your plan handles specialty drugs and the tiers is going to help you understand how much you actually have to pay out of pocket for your drugs, and also might change which plan you choose moving forward in the future. Now, in the United States, there's only 3 places where we get our health insurance coverage. We're getting it directly from an insurance company, like through the marketplace. We're getting it through the government, and by that I mean Medicare or Medicaid, military or veterans plans, state or local programs. But still 50% of people in the United States actually get their health insurance coverage through an employer. We think it's really important that people understand all of their health insurance options, so then they can actually compare those options and pick the plan that's best for them. Sometimes we assume that we only have one option. For example, if we get our health insurance coverage through an employer, we don't usually look for other health insurance options that we might qualify for. But if that employer plan doesn't cover your providers, or it doesn't cover your prescription drugs, or has very high out-of-pocket costs, that might be a reason where you look for other options to see if there's a way to lower your costs for healthcare. So at Triage Cancer, we have a lot of information to help people understand their health insurance options. And I just want to give you a quick example of why this becomes important. So Ross and Rachel Geller are married. And on July 20th, Rachel decides to take time off work to deal with her cancer treatment and recovery. She used to have health insurance coverage through her employer. And when she told her employer she was leaving, her employer gave her paperwork to elect COBRA coverage. COBRA would cost Rachel $800 a month. Ross has insurance through his employer that costs him $300 a month. And adding Rachel to Ross's policy would make the monthly premium go up to $500 a month. Rachel's worried because she has surgery scheduled in August, and she wants to understand how many options she has for comprehensive health insurance. Now, when we do this training with healthcare professionals, people will often come up with 2 or 3 of her health insurance options, but she actually has at least 4 different health insurance options. So she could take COBRA to keep her same plan through her employer. She could move to Ross's plan through his employer. She may also choose to buy a marketplace plan, which is an individual health insurance plan from a private insurance company. But because Rachel is 25, she could potentially also go back to her parents and see if she could be on her parents' health insurance plan until she turns 26. A deciding factor for her is going to be cost, so seeing which option is actually going to cost her the least. It's also going to be important for her to look to see which of those plans actually cover her providers, especially since she has surgery already scheduled, and then making sure that plan covers any of her prescription drugs. So as I mentioned, at Triage Cancer, we have a lot of resources to help people navigate understanding their various health insurance options, but then also how to actually pick those different options and then use your health insurance after you've made that selection. So I wanted to walk you through an exercise on how you actually compare plan options. And this exercise is useful if you're comparing different marketplace plans, if your employer gives you more than one choice to choose from for health insurance, you can use this exercise. You can compare what your employer gives you to the marketplace. And then if you have a Medicare Advantage plan, you can compare those plans using the same exercise. So here we have 3 plans. There's a bronze plan at $200 a month with an $8,000 out-of-pocket maximum. A silver plan at $275 a month with a $6,000 out-of-pocket maximum. A platinum plan at $400 a month with a $2,000 out-of-pocket maximum. Assuming that you are going to hit your out-of-pocket maximum during the year, because when we're talking about the cost of cancer care, the likelihood of hitting your out-of-pocket maximum is pretty high. Can you tell just by looking at these options which is actually going to cost you the least by the end of the year? And the answer is no. You can't tell just by looking at them. You actually have to do the math to see. And the way that you do the math is that you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket for your medical expenses during the year. So in this particular case, it turns out that the platinum level plan ends up saving you thousands of dollars by the end of the year, even though we might get sticker shock when we see that monthly premium compared to the bronze plan, for example. So unfortunately, most people don't understand how those out-of-pocket maximums work, and they only pick a plan based on the monthly premium. And unfortunately, that can end up costing you a lot of extra money by the end of the year. It isn't just about cost, though. You also have to make sure, again, any plans that you're comparing actually cover your providers and the facilities that you go to and any prescription drugs that you take. We do have an animated video on how to pick a health insurance plan, which provides an overview similar to what I shared today. So if you'd like to see it again, you can watch that. But we also have some worksheets to actually help you do the math. And we have a worksheet that is available for you to use and to do the math for private insurance, like a marketplace plan or comparing your employer options. And then we also have a version that is specific to Medicare and helps you compare the various Medicare options to figure out the best plan for you. And those are available for free on our website. Turning to medical bills for a minute, this is definitely not a strategy that we recommend. No avoidance coping. It's very important that you actually open your mail and take a look at the communications that you're getting from your insurance companies and your providers, because in some cases, there's actually some things that you can do and potentially ways to save money. But if you ignore the bills, then those options sometimes go away. Unfortunately, when we get medical care, it generates a whole lot of paperwork. And the first paperwork that you get might be from your insurance company. And you might be mailed paperwork, or you might be emailed paperwork, or it might even be something that shows up in your portal for your insurance company online, and you have to go and take a look at it. And the first communication might say, "We've received a claim," meaning your provider actually sent us a claim for care that you received. You don't have to do anything with that claim. They're just telling you that they've gotten that claim. Then they might send you a letter saying, "We're now processing that claim." Again, you don't have to do anything. They're just letting you know. But then the piece of information that's very important that will come from your insurance company is the explanation of benefits, or the EOB. And this typically looks something like this. So it's going to have information about you. It'll have a summary of the claim. It'll usually contain some version of a chart with the date that you received care and maybe a code or an explanation of that care. And then it tells you what the insurance company did with that information. How much did they allow for that charge? And then how much did they actually pay the provider? And then the third thing that they'll tell you is how much you're actually responsible for paying for that claim. And a really good EOB will also include what's there at the bottom. It keeps track for you of how much you've paid towards your annual deductible and your out-of-pocket maximum. So it's keeping track for you, although there's some value in you keeping track as well to make sure that they actually match. But the key piece of information that's usually on an EOB is that somewhere it says, "This is not a bill." You do not need to pay your EOB. It's just a letter from your insurance company telling you how they paid for that claim. And then The last piece of paperwork you're going to get is the actual bill from your provider. The problem with this process is that you don't always get that mail in the right order. Sometimes the first thing you get is the bill from the provider, or the things come out of order, like you get your letter saying we're processing the claim, and then a few days later you get the letter saying we've received the claim. And so it creates confusion because they don't come in chronological order the way that they should. But the key thing that I want to communicate today is that it's really important that you wait for the explanation of benefits before you actually pay the bill. You want to make sure that the explanation of benefits matches the bill. And first check, are there any mistakes in the explanation of benefits or the bill? And if you have any questions about that, you can contact the provider and or the insurance company to get clarification. And then once you've figured out that the bill is actually correct based on the explanation of benefits, then you can figure out what you actually owe. Unfortunately, if you get the bill first, the bill might not reflect all the payments from the insurance company. So you might end up overpaying the bill, and then you get the EOB and find that out. And then you have to track down that money and get it back from the provider, which is sometimes easier said than done. So that can help you to just wait for the EOB before you pay the bills. You also might be in a situation where you've received care at a hospital that is a nonprofit hospital that is required to provide what's called charity care. And some hospitals, in exchange for providing, getting a nonprofit status, actually have to provide free care in their community. And that might be actual free care, or it might be writing off some of the medical bills. The thing is it's kind of hard sometimes for you to know, do I qualify for these programs? And does my hospital actually have these programs? There's an organization called $4, which will actually do that legwork for you. Even if you've already received care and now you have a medical bill, you can actually contact $4 and tell them what hospital that you received care at and share the medical bill with them, and they'll figure it out. So they'll find out whether or not your hospital has to provide charity care and if you qualify for your hospital's program. And then they'll actually help you communicate with the hospital to try to get that charity care and your bills reduced. So this is actually a really great resource for people to be able to get help with this process. And then one other thing that often happens with medical bills is that insurance companies deny coverage for care. So they just say, we're not paying anything for this particular service because we're not covering it. And it's very important that you actually appeal those denials. We don't have to take no for an answer when it comes to insurance company denials. Specific to private insurance, meaning individual and employer plans, you have access to the internal appeals process, meaning you get to go back to the insurance company and ask them to reconsider their decision. But you also have access to the external appeals process, where if your insurance company says no, you can actually go outside the insurance company to an independent entity, and they decide whether or not the care that you've been prescribed by your healthcare team is actually medically necessary. And if they decide that it is, then the insurance company has to cover it. So I often call this the best kept secret of our healthcare system, because no one knows that this exists. But for the people who do actually go through the appeals process, between 40 and 60% of the time, depending on the state that you're in, patients are actually successful. And those claims are being overturned where the insurance company is paying for that care. So it's actually really worthwhile to go through the process, because you have about a 50% chance of actually winning your appeal. But when I say no one knows that this process exists, I actually mean no one, because in 2021, there were 48 million claims denied specifically for marketplace plans in 2021. And 99.9% of those denials were not appealed. So only 0.1% of those claims were appealed, just to the first level of appeal, let alone the external appeals process. So when I say no one, I actually mean no one. And unfortunately, the hurdle here is that no one knows this exists. Even though this became federal law in 2010, here we are 13 years later, and people aren't aware that they have this protection available to them. What is really concerning to us about this is that if people are being denied coverage for care, it means that they're not getting the care that they were prescribed by their healthcare team, or they're paying for that care out of pocket because their insurance company wouldn't pay for it. And so either way, this is very concerning because it either means patients aren't accessing the care they need, or they're paying for it themselves when the insurance company likely should have paid for it. And so that's only contributing to the problem of financial toxicity and the financial burden that patients and families are experiencing. So we really want people to be aware of this process and to let people know that it's available to them. So we have a lot of resources to do that. Depending on the type of health insurance that you have, we have resources to help you understand the appeals process and what your options are. When you are thinking about what you're paying related to your medical care, it's important to keep records of those expenses, not just the medical bills and the EOBs, but any receipts that you've paid for co-payments from the pharmacy, for example. Or did you have to travel to get to treatment? Or are you paying gas or parking or maybe tolls to get to treatment? All of those expenses could potentially be tax deductible. So if you itemize your taxes, those expenses may be tax deductible, and actually that could help you lower what you have to pay for your taxes or increase the refund that you get with your taxes. So it's potentially leaving some cash dollars on the table if you aren't keeping these records. So that can be helpful too. And then once you figure out what you actually are responsible for paying for your medical bills, if you feel like you can't afford to pay those medical bills, it's important to know that you can potentially negotiate with their providers. It is not uncommon for providers to set up payment plans if you're not able to pay that lump sum that you owe on a medical bill. You could also ask them to write off a portion of your bill. Even if you don't qualify for charity care, they still might be willing to discount a portion of your bill. And then if you have a bill that's $2,000, for example, and you can pay $1,000 right now, but not the $2,000, you might actually want to offer them a lump sum payment of $1,000 and see if they'll accept that, rather than a payment plan where maybe you're paying $100 a month for 20 months. So sometimes they're actually willing to work with you because they want whatever money they can get now, rather than extending that out over a period of time. So it doesn't hurt to ask. The worst thing that can happen is that they say, no, we won't adjust or create a payment plan or accept a lump sum payment. But if you don't ask, you won't know. And then if you need help paying your bills, it's valuable to think as creatively as possible about possible financial assistance that might be available to you. Sometimes when people feel like they need help paying their medical bills, they only look for financial assistance that pays for medical bills, where maybe if that individual would actually qualify for utility assistance in their community, they could take the money they spend on their utilities and apply that to their medical bills. So we encourage people to think as broadly as possible about how to actually get financial help. And at triagecancer.org, we have a toolkit called Cancer Finances, and it covers different topics. And one of the topics that we have is financial assistance resources. And those resources are sorted by the type of financial assistance that they provide. So some of them provide assistance with prescription drugs. Some of them provide assistance with copays. Some of them provide assistance with house cleaning services. So they're very diverse in the types of financial assistance that they can provide. So that's available on our website. And then we also have a topic on managing prescription drugs specifically that talks about the various programs that are out there to lower the cost of prescription drugs. And then when you get to this page, you'll actually also see a chart of all the pharmaceutical companies that make cancer-related drugs, and then the patient assistance program for that company. So the contact information is there, and it explains the type of assistance that they provide. So you can get directed to that information quickly without having to go down the rabbit hole on Google. Now, I do want to mention that we provide a free webinar series monthly, which covers a variety of different topics. But we recently hosted webinars on Medicare and then one on getting ready for open enrollment. So understanding how to make choices around health insurance for the marketplace and also employer-related plans. And all of our webinars are recorded and available on our website, so you can watch them at any time if you missed the live webinar. So I want to mention that that's available if you'd like to learn more about all of these topics and making health insurance choices. And then we also have a legal and financial navigation program where people can contact us with any of their questions related to health insurance or work or disability insurance or finances, really any other cancer-related legal issue. And they can set up time to talk with our staff to get personalized answers to their questions so that people can understand how the law applies to their situation, get a sense of what their options are, and then figure out how they can take next steps. All of the resources that we have at Triage Cancer, including our navigation program, are available for free. So today was intended to be an overview of some of the key things that we want people to understand about navigating insurance and appeals, but there are many resources available to you if you need more information. Thank you very much.